everyone. Good afternoon. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. You must have come across people, especially women with brown color patches on their face. They look like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across four Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. So, to avoid all these hazards and to keep you informed, today we are here to know more about management of melasma from an expert. So, let me introduce Dr. Devendra Jain, an esteemed authority in dermatology, venereology, and leprosy with years and years of dedicated experience. Dr. Jain's illustrious career began with his MBBS from SETH G.S. Medical College and K.E.M Hospital, Mumbai University in 1989, followed by a postgraduate diploma in dermatology and venereology from the same esteemed institution in 1991. Dr. Jan's expertise spans far and wide, having attended numerous national and state level conferences, workshops, training programs, enriching his knowledge in dermatology, cosmeto-dermatology, skin surgeries, aesthetic procedures, and lasers over the past decade. As a consultant, Dr. Jan has contributed significantly to the field, specializing in various skin surgeries, cosmetic procedures, aesthetic enhancements. His pioneering spirit led to the establishment of the groundbreaking Pratham Skin Care Centre in Virar, the first of its kind between Dahisar to Dahanu in 2002. He is also a life member of prestigious organizations such as IADBL, CSI, IMA. Dr. Jan's commitment to excellence and innovation is unwavering. It's such a pleasure to have you with us, Dr. Jan. And if I'm not wrong, you're also an avid trekker, right? You have been to the Everest Base Camp and Annapurna circuit trek many a time. So you have been to Himalayas, you have trekked down Himalayas. And regarding melasma, I have a question for that too, which I'll ask later in this session, because trekkers again have the problem, they kind of develop these melasma and hyperpigmentation basically. So I'll include that question as well, because you are the expert in that as well. So it's such a pleasure, it's such an honor to have you with us, Dr. Jain.
Thank you. My pleasure.
So, Doctor, today we are going to talk about melasma, and melasma is very common in our society, especially in women. So, to start with, Doctor, what is melasma?
Actually, melasma is a hyperpigmentation condition, and it is more commonly seen in women, though it is also seen in men also, but the ratio is around, say, 10 to 12 women. If you see, you can encounter only one male patient. So usually it appears on the cheeks and on the nose, but there can be different varieties of melasma. Different areas can get involved, like even upper lips can get involved. Means the area between the nose and the upper lip. So this can get involved. You can get melasma over the eyebrows. Sometimes you can get melasma at the side locks. Okay. So there are the different varieties of melasma, but basically melasma is a type of hyperpigmentation, though all hyperpigmentation on the face is not melasma. So that has to be kept in mind.
Okay, so melasma and hyperpigmentation are not the same. They are different, right? And hyperpigmentation, if I'm not wrong, is a umbrella term. It's a bigger, broader term.
True. So melasma is a type of hyperpigmentation, but all hyperpigmentations are not melasma.
Right. Okay. And doctor, what causes melasma?
See, exact cause is not known to science yet. Earlier, it was thought that it is maybe hormonal changes in the woman, because usually you see the patients in the age group of post partum, means middle age woman who has conceived, who have delivered child. Either it appears during the pregnancy or later on after the delivery. But then you also get melasma in men also, where you don't have these issues. So the multifactorial cause may be, mostly it is genetically mediated, means the patient has the genetic, uh, you can say, predisposition to develop melasma. So there is a family history most of the times. It may not be the first degree relatives, it may be second degree, it can be from maternal side, from paternal side. And other causes are excessive sun exposure. Some medications, if the patient is, suppose a woman is taking OC pills for a prolonged time, that can predispose to melasma. Then you have certain medicines, especially I told you oral contraceptive pills.
Yes, of course.
And sun damage is more important. But most important thing is genetic predisposition has to be there.
Right. So family history could be one culprit. Sun exposure is also there. So these are the big players, we can say, in causing melasma. Now, doctor, are there also any symptoms associated with melasma, or it's just the appearance? It's just the patches that comes up as signs of melasma.
Mostly, melasma doesn't have any symptoms. It is the appearance, because it is a change in the color of the skin in that particular area. So it is the patient's symptom is not there. Patient is not suffering from anything. There is neither any itching, nor there is any pain, nor any redness or anything. Only thing is it is been seen. So mostly it is sign. It is not a symptom.
Okay, doctor. Doctor, you also mentioned that many a times pregnant women experiences melasma. They have, melasma, and many a times postpartum after delivering, melasma just disappears or fades away. But many a times it stays. So we would like you to shed some light over that melasma during pregnancy and after
See,
postpartum.
mostly, as I told you, melasma usually appears in women of middle age.
Okay.
So it is usually, we never see melasma in teenagers, uh,
Okay.
even in females. It's very, very rare. I don't think I have seen at least one or two patients maybe in my career. Teenagers or very early, those women who have, girls who have not yet married, not yet have uh, started family, they developing melasma is very, 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 very rare. So during pregnancy, it can appear, usually late pregnancy, and it doesn't disappear after delivery. I mean, it remains actually. The
Mhm.
starting point may be the pregnancy. Sometimes it may start after the delivery, means postpartum, but it remains. It doesn't disappear. But we have seen in some females after postpartum, not sorry, postpartum, it is postmenopausal. Means once the patient, female stops menstruating, there are certain hormonal changes in their body, and so suddenly the melasma disappears. So that has been noticed, but exact cause of that is not yet been established, and it doesn't happen in all the patients. In some patients, we have noticed that after menopause, the melasma suddenly disappears in some patients. Yes.
Okay, doctor. And doctor, in medical, science and medical sector, we always say that precaution is always better than cure. So, is there a way to prevent or delay melasma in any way?
See, if there is a genetic diathesis, I don't think you can uh, prevent, but yeah, you can delay the appearance by, knowing if in your family, any of your close relative, usually we call it blood relatives, if they have melasma, then you should be little careful. You can start using sun protection very rigorously early in your life. Uh, Not only UV protection, but nowadays they say even visible light, blue light, and infrared, which usually coming from the cooking range. When the woman is cooking in the kitchen, the heat is generated because of the gas, and that is also emits the infrared light. So that can also be one of the causative factor or making the melasma worse. Even visible light and blue light nowadays, the work culture has changed. Most of the people are for long hours on some gadgets. So either it can be laptop, PC, or maybe mobile. So
Mhm.
uh, that blue light also makes the melasma worsens. The pigmentation can become dark. And if somebody is working in some showroom on some corporate offices where there is a lot of visible light, so they
Mhm.
have a lot of LED bulbs to make um, uh, the area very lighter,
Lit,
lit.
yeah.
So that can
Um,
also, if you are there for many hours, then that can also make the melasma worse. So what is important is you should wear a sunscreen, uh, which is not traditional only SPF or PA plus, but it should cover even the blue light and infrared light. And it's not like that ki wearing sunscreen only when you are outdoor. You should
mm.
wear sunscreen even when you are indoor where there is a lot of visible light. You should wear sunscreen when you are doing some cooking or where there is infrared light. So practically you should wear sunscreen throughout the day. Once you go to bed, are going to retire, you remove your sunscreen and then go to bed.
That's a very important information that you have just parted because normal belief यही होता है कि सनस्क्रीन यानी जो हमें सन के जो हार्मफुल रेडिएशन है उससे प्रोटेक्शन दे इसलिए हम लोग बाहर जाते वक्त सनस्क्रीन यूज करते हैं however the irony remains that in India hardly 30% is using sunscreen as a routine regular thing. Otherwise if we are going on a beach vacation or something, that's when we buy and start applying sunscreen. But on routine, regular basis, it's still not there with most of us. So, but now as you said कि अगर आप घर के अंदर भी हैं, ऑफिसेज में हैं जहाँ पे एलईडीज है, लैपटॉप के सामने है, मोबाइल स्क्रीन के सामने है, खाना बना रहे हैं अगर, बिकॉज मेनी टाइम्स हाउसवाइफ्स दे नेवर यूज सनस्क्रीन कि मैं तो घर पे हूँ, किचन में काम करती हूँ, मुझे क्या दिक्कत है, क्यों जरूरी है सनस्क्रीन लगाना. बट देन हम कई बार देखते हैं महिलाओं में खास तौर पे जो होम मेकर्स हैं उनको भी मिलाजमा होता है और बड़ी संख्या में होता है. वैसे में ये बहुत जरूरी है कि हम सनस्क्रीन अप्लाई करें. नाउ डॉक्टर देयर आर सो मेनी थिंग्स, वन ऑफ कोर्स दैट व्हाई शुड आई यूज सनस्क्रीन ऑन रेगुलर रूटीन बेसिस. एक तो आपने क्लैरिफाई कर दिया कि आप घर के अंदर हो बाहर हो, अगर विजिबल लाइट्स हैं, अंधेरे में नहीं बैठे हो तो आपको सनस्क्रीन लगाना है. Secondly, many times people will say that I get, white cast, white patches, which I'm not very comfortable with, or it makes my skin very oily or patchy or dull. There are so many things, so many justifications or complaints people have with sunscreens. So, what's your take on that? How can we make sunscreen an integral part of our skincare routine?
See, first of all, you have to get your skin. Best thing is to get a professional advice because, uh, you know, the doctor who is a specialist in dermatology can take your work history, your routine, you analyze your skin, what is the pre-existing conditions on the skin, and why you should need a sunscreen. So accordingly, you can categorize because in India nowadays, you get lot many types of sunscreen. Now there are gel-based sunscreen. Even there are sunscreens for oily skin which are very transparent and like water. So there are sunscreens which are matte finish. So silicone-based sunscreen, they don't create any white cast. They don't make the skin very messy, oily, or they make you perspire. So these things does not happen if you choose a proper sunscreen because market is flooded now. There are a lot of pharmaceutical
True.
companies which make these sunscreen because at the end of the day, what is important for the sunscreen is the patient should be able to use it regularly. It is not like that ki, this sunscreen is the best as a result wise. And if I write, but the patient is not comfortable using it and he or she stops using it, there is no point of me writing the sunscreen on the paper.
True.
So what is important is the compliance. The
Right.
person whom I am writing the sunscreen should be able to use it regularly as advised, very pleasurably. He
Hmm.
or she should be using it.
So one
So
should be in a comfort level with the sunscreen. So that's
yes,
how we can,
if
use it
so because
regularly.
if there is no compliance, there is no point of writing that sunscreen. So sometimes you can do one. Another thing is you can use smaller packs and use 2 3 sunscreens to see
Hmm.
which suits you, like we do with shampoo. Okay,
Ah,
every person doesn't suit the same shampoo. Okay,
right.
so what we advise ki you take smaller sachets, use it 2 3 weeks, see different brands, whichever suits with you. continue that. So similarly in sunscreen also you can do the same thing. Okay.
Right.
The sunscreen which you have, suppose you have bought, if it is costly, if you're not liking it on the face, you can use it on the same sunscreen, you can use it on the hand, on the back, and you can buy another sunscreen for the face which gels well with you. And once you know if this sunscreen gels with me on the face also, then you continue with that, using it all over the body, whichever part is exposed, and you can use it like
Right. And as you said, while buying a sunscreen, it's also important to see that it is giving protection against, the blue light as well. So we should consider that as well. And what is
that.
the way to
Even
apply? Yes, doctor.
even infrared, not only blue light. The
Okay, yeah.
cooking range now that emits
Uh,
heat. So that is infrared. So
uh,
basically, it's a very broad spectrum sunscreen nowadays. The concept is it should be a very broad. Earlier, it
thoughts.
was only UVA, UVB. That was the
Hmm.
concept. Okay.
Hmm.
Now for UV, and there were two parameters. One was SPF, and another for UVB, it was PA plus plus. I mean, if you
Right.
see, or star rating, boost star,
Boot
three,
star rating.
yeah, 3 or 4 stars. So that should be the idea. But nowadays, along with this, you should go for infrared and blue light protection. Yes.
Fair enough. And what is the way to apply? How much to apply? When to reapply? Because all these plays important role, right?
Yes. Uh, See, how much to apply is ideally, if you see, um, it should be applied at least 2 finger for the face, this much. Okay. But this much becomes little too much for the patient because it becomes
Mm,
little messy and oily. Plus,
mm,
in hot and humid conditions like in Mumbai or coastal areas where you perspire a lot, and if the person is outdoor, then that usually patient does not apply that much because it becomes little practically little impossible. Another thing is cost also is important. I mean, when a person buys the sunscreen, maybe initially few days they may apply as it was advised, but as the month end comes, you know, then the
I
budget
agree.
issues, then they try to squeeze and try to apply little. So how to compensate that is you go for a higher SPF. See, in
Mm,
Indian skin, what is recommended is anything SPF above 30 is enough.
mm,
Okay. But then that is under ideal condition. You should be applying enough quantity,
mm,
enough frequently, then
mm,
SPF 30 is enough. But how we compensate that? By making little higher SPF. You can buy SPF 50 plus.
mm,
Okay, little higher con. So where you apply it, even if less, then also it will give you protection,
mm.
better protection rather. Okay. So nowadays there are sunscreens which are available in India up to 100 also SPF.
Okay.
Yeah.
They give
So
100% protection?
no, nothing is 100%. So sun protection is not never always only with sunscreen. You should do
Okay.
even physical protection also. So that is like wearing a good hat or cap. Okay. Second thing,
Sunglasses and cotton
sunglass.
scarves, etc.
Yeah,
Mm,
something on the face like mask or something.
mm.
Cover your body fully with clothes whenever you're outdoor. So these things also contribute. Nothing is 100%. So the more factors you add on, you get better protection.
So along with sunscreen, you can't
Yes,
miss out on sunscreen. Use sunscreen and then the physical
true.
protectors.
Yes, yes.
Right.
Because through fabric also, the sun rays do go. I mean,
Hmm.
they do
Nowadays, even
penetrate.
SPF, even fabrics are coming with the
Yes,
SPS, right?
true. There are certain fabrics, especially they are available at sports outlets like Decathlon and all, where
Hmm.
people who are doing a lot of outdoor activities like bikers and cycling, those who go
Hmm.
for trekking and all, for them they are those clothes which protect you from this thing, but that is not 100%. It is an add-on, you can say. So multiple things if you use together, you may get very good protection. That is what I mean to say. Yeah.
Right. So, using sunscreen regularly is very important. Protecting
Yes, how
using others.
frequently you said
Yeah.
how
Yeah.
frequently is ideally it should be every 2 and 2.5 hourly
Okay.
because with perspiration and all, and again it gets absorbed in the skin, so the efficacy goes down,
Uh,
and that is in normal thing. But there are certain sunscreen which they claim they gives you 8 hour protection, but I don't think it is a claim under ideal condition, but we
hmm.
don't get ideal condition all the times. So you have to take that with pinch of salt. But those who have said 8 hours, you can say maybe 4 hours, they may give you protection. So you can apply less frequently. Another thing is if you sweat a lot or if you go for swimming, so if you are in the water, then the protection time goes down. Like swimming, they say it is 50 minutes only, 50 minutes. So if you're going for swimming, every 50 minutes you have to apply sunscreen if you want a good protection. Okay. If you are sweating a more, then you have to apply little more frequently. See, whatever is mentioned on the product information, that is under ideal condition. Like suppose you buy a car or a two-wheeler, they give you this much mileage they give per liter, but that is under ideal condition. You don't get in city or in the traffic. So
Right.
similarly with the sunscreen.
Now, doctor, when a person comes to you with these patches on their face, so what is the way to diagnose? Just by clinically or physically examining, you can say that, yeah, this is melasma, as this is how, deep it is. Or do you also conduct some tests?
See, melasma is mostly it is a clinical diagnosis. Okay, so you don't have to do any test, but
Hmm.
to know the depth of the pigmentation, you can conduct one simple test which is known as Wood's lamp examination, where
Okay.
there is uh, a light which is little blue color and it has a wavelength of 311 to 313 nanometers. So you take a patient into a very dark compartment and you expose that area with Wood's lamp. So the pigmentation, if it becomes exacerbated, means if you see through the Wood's lamp, the pigmentation is more visible, then you know it is epidermal. Epidermal means it is a superficial pigmentation. It is in the upper layer of the skin.
Right.
If the pigmentation doesn't become much of change, there is not much of change as you see with naked eye and through the Wood's lamp, then it is mostly dermal, means it is little deeper. So you know the outcome. You can tell the patient how it is going to, because epidermal pigmentation is easy to treat. But frankly speaking, no melasma is pure epidermal. It is mostly combination. Some part of it is epidermal, some part of it is dermal. So epidermal is going to improve. So the patient who has more epidermal is going to give you good response in short period of time. But patient who has more dermal, then you have to be a little cautious and tell the patient the prognosis. It may take long. It may not improve that to that extent as you desire. I mean, so
Right.
this is more of prognostic value rather than a diagnostic.
And doctor, what are the treatment options available?
Treatment, there are many types of treatment we have come across. I mean, over a period of time, over a period of years, lots and lots of molecules have come in India. And so there are oral medications like antioxidants. Then there is tranexamic acid nowadays we are using, which is mostly used in females for excessive um, uh, menses, like excessive bleeding. So to stop that, usually it is used by gynecologists, but here we use in low dose and it helps. And vitamin C and other antioxidants can also be used. Then topical bleaching agents are there, right from hydroquinone, which is the age-old one. And then you have newer agents like kozic acid, azelaic acid, you have glycolic acid. Um, so plethora of things are there, and there are a lot of combinations available nowadays, good combinations. So you can
Right.
use a lot of things. So usually we start with, uh, first important is how old the melasma is. You have to take a detailed history. Patient has used anything previously before they have come to you. Second thing is, if the patient is on on any other medications, especially OC pills, history is very important. Then how is the skin condition when the patient is coming to you, because most of the time the patient don't take care of their skin properly. They don't use proper face wash. There is no hydration. They don't use moisturizer. They don't do use any sun protection. The skin is already damaged. Melasma is one part, but it is a damaged skin overall. So if you give all these medication initially without improving the skin condition, that medication can cause irritation leading to inflammation, and then it can cause more hyperpigmentation. So you have to
Right.
improve the skin in a first, and explain the patient. Your main treatment will start little later. First, we'll take care of your skin, because these active medications are not going to act tolerated by your skin at this juncture. So we'll make your skin better in a way so that these molecules can be tolerated. So there are not certain new medications are nowadays. A lot of phytochemicals are coming into the market. A lot of plant derived uh, agents which reduce the pigmentation. Uh, Cysteamine is another drug which has come recently, though
Mm.
we cannot give you judgment at this juncture because it's just launched in India. So we are just trying, and they claim it is a good medication. So let's see. It will take some time to give our opinion on it. Yeah.
But as you also mentioned, doctor, many a times it is a challenge to see what the patient has already, done to their skin apart in view of treating melasma. For example, we have home remedies, which is very popular in our society, in our country. We have over-the-counter medication because it's easily accessible. Just a chemist shop में जाना है और बोलना है कि भैया देखो मुझे कुछ दाग हो रहे हैं कुछ दे दो, and will because initially these creams, these because they are steroid based, they work magically. तो इनिशियली वी फील कि अरे वाह ये तो मैजिक क्रीम हाथ लग गई है, बहुत इजीली हमारा ये जो भी melasma था, पिगमेंट्री इशू था, ये जा रहा है. Only after when our skin becomes addictive to it, when we find out कि अब तो नहीं हो रहा, out of control हो रही है situation, that's when we go and consult a dermatologist in most of the cases. So, how tough it is to treat a skin which has already gone through home remedies and over-the-counter medications, etc., etc.
See, it is very difficult at that juncture, because what happens, the patient has seen the magical result as you saw it.
Mm.
Okay. And already the skin has been damaged because of the topical steroid abuse for prolonged time. The skin becomes thin. It becomes, the what do you call atrophy happens. There is redness. The vessels, blood vessels, which are below the skin, starts. They become visible. We call it
Yes.
telangiectasias. And if you use a combination cream with hydroquinone for prolonged time, there is one condition called ochronosis, which sets in, and that time it becomes very difficult. And what happens ki, if you stop the steroid, there is a rebound, we call it. Everything flares
Mm.
up and the skin becomes
Mm.
more worse, which patient, mm, they are not in a position to listen or accept that. But then it's like a two-edged sword. If you continue using the same cream, skin is going to get damaged more. If you stop, there is a sudden flare. So you have to
Mm.
counsel the patient, and patient should understand. First of all, there should not be any home remedies or home treatment. It's a very, very dangerous trend. And you didn't mention nowadays, there is a
The
trend of,
influencers.
yes, the
Mhm.
so-called influencer, the so-called social media, Insta. So nowadays, a lot of youngsters, they use unnecessary things which may not be needed on their skin actually. When they come
Mm.
to us, they always bring 3, 4 serums with them. I'm using this. But then are they needed on your skin? So there is lot of misuse, and because of that, there is a lot of problem created, and the patient suffers ultimately. See,
Right.
doctor will counsel you, will try to wean off from that, but then you have to keep patience, and then lot of time goes into it. So my advice is, whenever there is some skin issue, consult a proper dermatologist nearby you and take medications according. See, it's a question of just some time and few money. The fees
Mm.
consultation. But
Right.
in the long run, it is more beneficial to you if you see that way. See,
Absolutely.
you go to a chemist, you buy over the counter. Chemist doesn't know what does it contain, what it is going to harmful, how long you have to use. Another advice I will like to give at this platform is, always respect the prescription as it is written. Suppose the
Mm.
doctor has written use for 15 days, use for 15 days, and then again visit, because you
Mm.
never know. See, it is easy to drive a car. You have to just push the escalator. Sorry, what do you call um, the speed? This thing to increase,
Ah,
but
escalator. Yeah, yeah, yeah. I should just
escalator.
need to
But
escalate.
yeah, but what is important is when to put the brake. If
Break.
you don't know that, then there is no point in driving a car. So when to stop a medication, how to reduce that medication slowly, that only the
Mm.
professional knows. That you never
Right.
know. that medication may have been started on you by a doctor to give you good results initially, and then maybe for long term it may not be that useful. He will switch over to another medication which you don't know at what point you have to
Hmm.
do. So people
Right.
keep on using, and when they come to us or they go to some other doctor and they say, ये तो किसी डॉक्टर ने ही दिया था हमको, बट दे नेवर
I
से कि
agree.
डॉक्टर ने हमको बोला था 15 दिन ही यूज करो और हम 2 साल से यूज कर रहे हैं,
Use करना.
है ना. So ultimately the sufferer is going to be the patient, so they have to be,
Hmm.
you know, following the prescription according to the advice of the doctor. That is very, very important, which most of the times
Exactly.
doesn't happen.
आई नो. आयरनी इज कि अगर हमें चेस्ट में पेन हो तो हम सबसे पहले एक डॉक्टर के पास जाते हैं, कार्डियोलॉजिस्ट को दिखाते हैं, फिजिशियन को तो दिखाई देते हैं कि अरे चेस्ट में पेन हो रहा है, लेकिन स्किन के साथ कुछ होता है तो हम तुरंत डॉक्टर के पास नहीं भागते. दैट्स द आयरनी. वी टेक इट सो लाइटली कि अरे कुछ लगा लो, ये लगा लो, वो लगा लो, टर्मरिक लगा लो, ठीक हो जाएगा. वी डोंट नो दैट इवन दैट इज अ केमिकल. हम नेचुरल के नाम पे इतना केमिकल लगा लेते हैं. फिर ओवर द काउंटर मेडिकेशन है, क्रीम्स लगा ली, टॉपिकल एप्लीकेशंस, और डॉक्टर के पास जब हम पहुँचते हैं तब हमें लगता है कि बस अब हमें 1 हफ्ते में ठीक कर दो. वी डोंट
Yes.
अंडरस्टैंड कि हमने उसको कितने लंबे समय में इतना रूइन किया है. So don't do that. The whole purpose of having this session is to make us all aware that why it is important to go and consult the right expert, which is a qualified dermatologist in case of melasma. Melasma में ये भी होता है, doctor, I'm sure you'll agree with me. There are so many parlors, saloons, those uh, uh, centers where no doctors are there, but then they do procedures for these pigmentary issues, melasmas, etc. I'm sure they are equally harmful, equally dangerous. So it's again very important to go and consult the right person, which is a qualified dermat like you. But then many times a big question from the patient side is that will it completely go away? पूरी तरह से ठीक होगा या नहीं?
देखिए, मेलाज्मा एक ऐसी कंडीशन है जो पूरी तरह से यूजुअली मोस्ट ऑफ द केसेस में नहीं जाती, लेकिन अगर ऐसे हम देखें तो बहुत सारी बीमारियां हैं जो लाइफ थ्रेटनिंग है जो पूरी तरह से नहीं जाती.
हम्म.
जैसे मान लो आपको अगर किसी पेशेंट को डायबिटीज हो गया,
हम्म.
तो वो ये बैठ के नहीं बैठ जाता है कि ये बीमारी नहीं जाने वाली, इसके मैं इलाज नहीं करूंगा.
हम्म. Agree.
उसको लाइफ लॉन्ग दवाई लेनी पड़ती है. एक पेशेंट को कार्डियक प्रॉब्लम हो गई, उसका बाईपास सर्जरी हो गया, फिर उसकी दवाइयां बंद नहीं होती. वो ये नहीं बोल सकता कि मेरी बाईपास सर्जरी हो गई तो मैं अभी कोई दवाई नहीं लूंगा.
हम्म.
उसको लाइफ लॉन्ग दवाई लेते रहना पड़ेगा, नहीं तो उसको दूसरा बाईपास जल्दी से जल्दी लग सकता है, और देयर कैन बी
Right.
थ्रेट टू हिज लाइफ. Okay,
हम्म.
so there are many conditions, not only skin conditions, including melasma, which may not completely go. But for that, if you sit on it, it is going to get worsen, and ultimately, your confidence is going to go down. You will be, remaining away from the social function, society, your self-esteem, everything is going to get affected. Nobody else is going to get affected. Okay, so you have to take the call. If the reduction can be given to you in such a way that it is acceptable, then why not to go for it rather than going for that guarantee, so called. है ना?
राइट, राइट.
Yeah.
अच्छा,
So
melasma overnight भी पूरे चेहरे पे नहीं हो जाता है. I'm sure it starts from
yes,
small patches, right?
yes. So
So
early
again it
treatment.
becomes.
Yeah,
Yes, doctor.
if you consult the, I mean, take the advice professionally at the early stage, it is
Hmm.
very good, because you will be given good insight into sun protection, the importance of sun protection. You will be counseled to use screen so that it doesn't become more worse and it becomes bad. So early treatment is very, very important. And I just want to go to little previous, you said regarding chemical and all. So I
Hmm.
tell my patient, what is water?
Hmm.
It is H2O.
Chemical H2O, yeah.
So isn't a chemical. So you don't drink water. What is air? Oxygen for you. It is O2. It
O2,
is chemical. So you don't
right.
breathe. So what is chemical? Everything. Turmeric extract is also chemical. Everything is chemical in this world. Nothing is
Hmm.
chemical. Okay. Something are plant derived and something are made in the lab. That is the
Hmm.
difference. And everything has side effects. sometimes, the patient has, our mind has become very skeptical. When you go to a doctor, you go for a good results, okay, to get something good. The doctor prescribes medicine to make you good. Nobody wants side effects, neither the doctor nor the patient. But the
Not
first
the patient.
question is this only: Doctor, is there any side effect? Which is going to happen in 1 in 1,000 or 1 in 10,000. So why you assume you are only going to be that? So that is
Mm,
like a negative thought process. So keep negative thoughts away. I tell them, if you suppose homemade food is made by your wife or your mother, okay, your favorite dish is made, and you eat little more, you know, जो घर का खाना है, आपने ज्यादा खा लिया तो दूसरे दिन पेट में बदहजमी हो जाती है, तो
mm,
वो खाने का साइड इफेक्ट हो गया ना.
right.
तो जब 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 खाने का भी साइड इफेक्ट हो सकता है, तो दुनिया में हर चीज का साइड इफेक्ट होता है. तो इट
दुनिया
हैज
में
टू बी.
रहने का भी साइड इफेक्ट है. If you're living,
यस.
you are about to die. So
यस, ट्रू. सो
दुनिया ही ऐसे बनी है.
हाँ, तो आपको जुडिशियस यूज करना है, और वो जुडिशियस यूज कैसे कर सकते हैं? प्रोफेशनल एडवाइस से कर सकते हैं, प्रोफेशनल सुपरविजन से कर सकते हैं. सुपरवाइज जुडिशियस यूज will not give you any side effect. And in case, suppose you are that 1 in 10,000, then
Mm,
you bring that to the notice of your treating doctor as early as possible, so that there can be remedial action for that. You just don't sit and, you know, what you call, stop everything and stop doing everything. Then
mm.
your condition will not be treated and you
Right.
will be the sufferer. Yeah.
There are viewers who have asked questions. I'll take them one by one. So, Kirti Kapoor, any dietary changes to cure this issue?
No, melasma, diet has no role on melasma.
Okay. Ria Sathi, are there any over-the-counter products for the same?
I just said avoid using over the counter products. You can buy a good sunscreen over the counter,
Hmm.
but then again, you have to know your skin, the type of work schedule you have. So, all these factors, if you are okay with that, then you can use a over the counter sunscreen, that is fine. But see the label properly. What is it giving you? Okay.
Right. Purvi Mehra is here. Her question is, how can I effectively monitor and track the progress of my melasma treatment at home?
Melasma, usually, I told you, it is just a
Visible. It's
change.
about the appearance,
Yeah,
right?
it is about the appearance. It is change in pigmentation. So when the treatment is effective, obviously your pigmentation is going to go lighter in the shade. So that is the progress you can monitor, visually. There is nothing, some extra gadgets or some tests is required for that.
Right. And doctor, one more question regarding application of sunscreen. Again, because you are an avid trekker, you have been uphill so many times. We see, during trekking or those who are mountaineers, etc., they get really bad. I don't know whether it's melasma or not, but pigmentation is there, hyperpigmentation is there. Plus, those who live in those regions or who live up hills. But again, it is a tendency when we are going for a beach vacation, we'll keep a sunscreen with us. When we are going uphill, we'll say that we don't need sunscreens. So because you have been there, you have done that. So what's your experience? Plus, you are a doctor, connoisseur of this field. So why it's equally important to carry a sunscreen if we are going uphill?
See, I'll tell you, as important it is to apply sunscreen when you are on the beach vacation, it is similarly important to apply sunscreen when you are going uphill, because the radiation amount is more when you are at a higher altitude, because you are nearer to sun comparatively. You
Mhm.
are going at a higher altitude and you are open in the mostly. See, there are two types of terrain when you go for trek. Either it is a barren terrain. As you go above 10,000 feet, the tree line goes down when there are no
Mm.
trees, so you don't
Right.
get shade. Okay, so you are open most of the time. Plus, if you are going in, say, snow-clad areas, in the winter and all, and there is a lot of snow around, then the snow acts as a reflective surface. So it is as good as beach. Like beach, water acts as a reflective surface. So there are double attack on you. One is directly the sun, which is hindering you, and another
Mm.
is that 100 times reflective surface, which is reflecting the light and throwing out at you. So you need more sunscreen. It should be of more SPF, okay, and you should be applying frequently. So this is very important.
And Doctor, before we sum up, anything that we have missed out on, or anything that you would like to say before we conclude the whole session?
Um, Now, my take-home message will be for all the August audience is don't neglect your skin problems, any problem. Okay, skin is the largest organ of the body. If you, I mean, and it's the most visible thing. Okay, so your confidence, your look, everything depends on how you present yourself, and the skin is visible, especially face and everything. So first is don't neglect any changes on your skin which you notice. Take good advice from a professional, this thing, and skin advice should be taken from a qualified dermatologist. That is very important, because nowadays, there are a lot of so-called cosmetologists, estheticians, but you have to see their degree. Only some courses here and there don't make you a qualified dermatologist. A dermatologist is one who has done MBBS first, okay, and then post graduation. Now, post graduation can be 2 years or 3 years. 2 years is diploma, 3 years. So see their degree, okay, that is very important. And make a habit of using sunscreen regularly, because the maximum damage is done on the skin, not only pigmentation, but even signs of aging. If you compare a farmer who is a 50-year-old, or say fisherman who is 50-year-old, okay, and they are in sea, the fisherman is in the sea for many years since his teenagers, and a farmer is in the field for many years. You see, imagine their face. They will have a lot of wrinkles on their face. The skin will be sagging. They will be looking more older than their age.
True.
And if you imagine 50-year person who has worked all his life in a closed environment, not much exposure to the sun, or they have taken a lot of care of their self, applying sunscreen when they are out and all, then their age will be looking less. Compare, just
Right.
imagine these two, same age. So
Agree.
what is the difference? The difference is one person has taken care of the skin. They are not much exposed to the sun. So it is anti-aging also. So sunscreen is very important. Keep a good lifestyle, avoid smoking, avoid alcohol, avoid late nights. Good healthy diet is very important. Hydration is very important. Nowadays I see teenagers, they somehow, I don't know, lot of teenagers, they say I drink less water. I don't know why. 70% of your body is made of water. So if you are dehydrated, whole system gets tipsy tot, it's upside down. And good nutrition is also very important. You should, according to one study, they say 40% of your food should be raw food, means uncooked food. So you should eat vegetables, you should eat uh, fruits, fresh fruits, salads, and all those things. So this is my take home message. And don't use any over the counter products. Don't use steroids unless the it is prescribed by your doctor, and that too up to the time they have mentioned. That is very
Right.
important. Up to the time they have mentioned. Steroid is not a drug you should be getting scared of. Some people, they have steroid phobia, which is also wrong. You know, Steroid is life-saving drug. In emergency, steroids save life, but overuse of it may cause problem. So the doctor knows when to start, when to stop. So follow that
Right.
instruction. That is very important.
Thank you so very much, Dr. Devendra Jain. It was wonderful talking to you. Thank you for this very informative session. Thank you so very much once again.
Thank you. Thank you. Take care.
Thank you, Doctor. And viewers, thank you for your active participation. Stay connected to our beautiful, spotless skin page. Stay happy, stay healthy, stay spotless. Goodbye.